That's when you hear people say
it's not what they're talking, it's eyewitnesses.
Ratify the World Health Organization Framework Convention on Tobacco Control. That framework recommended many effective ways of controlling tobacco in its various stages and protecting the public health of everyone, most especially Nigerians. One of the recommendations of the FCTC is about 70% tax increase, 70% of the price on tobacco products. While Nigeria is currently around 20%, the FCTC is fundamental to reduce the devastating global consequences of tobacco products on health, lives, economics, and the environment. It has been established over time that tobacco tax increase is one of the most effective ways to ensure that we reduce the use of tobacco. So it's increased price on tobacco products, and it's also in the same line gives us a most cost-effective policy for tobacco use reduction, most especially among the poor. Tobacco tax increase also increases revenue for the government. Thus, effective tobacco tax increase presents a win-win policy for public revenue and the public health. Marking is a fraction of this tobacco revenue is one of the best practices from around the world for the promotion of public health. About 30 countries from all regions of the world, including Africa, earmark tobacco tax revenue for health purposes, and that has given them outstanding results in public health. The World Health Organization recommended the use of tobacco taxes to fund healthcare programs in its World Health Report of 2010. And this focused on health system financing, recognizing that the use of even a small proportion of the revenue from health would greatly improve access to health services. If we come back home, in Nigeria, the 2018 budget has about 3.9% allocated to health. And that is far below the benchmark of the African Union in its 2001 Abuja declaration, which agreed for a 15% budget for health. So this shows a critical underfunding of the crucial health sector. And tobacco tax marking provides us an easier solution to this problem. If we continue to abandon our health facility and our health care, and the government will give the excuse that they are funding public infrastructures, who is going to make use of those infrastructures when the health of the citizens continue to suffer? Like Argentina, Bangladesh, Cape Verde, Colombia, Comoros, Cote d'Ivoire, El Salvador, Guatemala, India, Jamaica, Korea, Madagascar, and so on and so forth, who earmark for health programs. One of the greatest dangers that tobacco poses to our nation is to the health of the people. Tobacco affects the economy, it affects the environment, and many other things, but the first thing it affects is the health of the users and even those around the users. And so if tobacco poses a devastating damage to the health, then taxes raised from tobacco products should equally be used to improve the health care of the nation, and that is what earmarking represents. Nigeria as a nation has earmarked over the years. The petroleum PTDF is an example of earmarking, is now Education Trust Fund and all that. There are quite a whole number of earmarking. And so we are not asking the government to do what it has not done before. Our ask are simple, it's just three. First, we ask that Nigeria approve the tobacco control regulation which will make it possible for the setting up of a tobacco control fund So the law has been passed, the regulation has been passed. Now it requires its implementation. When it is implemented, then we can talk of setting up the Tobacco Control Fund, because the National Tobacco Control Act of 2015 provides for the setting up of a tobacco control fund. And up till now, nothing has been done in that regard. So we will ask that the federal government should commence the process of earmarking a significant fraction of tobacco taxes and levies for tobacco control, and not only tobacco control, also national health coverage. We also ask that the National Tobacco Control Act of 2015, which provided for the setting up of the Tobacco Control Fund, be implemented immediately. We also ask that the government should continue to increase taxes from tobacco. Nigeria is still far below the World Health Organization recommended 70% of the retail price of tobacco products. Presently, we are around 20%. We still have like 50% gap. So there is so much more that could be accruable to the federal government from tobacco tax, and we expect the government to put enough taxes on tobacco for the sake of public health and for the sake of the protection of the health of Nigerian citizens.
Public health. Earmarking is not new. I think it started way back. I remember the state of California started as back as 1988. And as Shion said, several countries have also, joined that. Why do we ask for earmarking? First is the fact that if you look at the budget, what we have now for health services, health promotion in Nigeria is way below what we need. And of that, little is being spent on tobacco control, which is killing a lot of people. So it means we will be able to have additional resources to be able to tackle, tobacco-related issues in Nigeria, as well as other public health-related issues. But back to the issue of taxation, I just want us to know that Nigeria is way below the ladder. So while we are asking for earmarking, we are also asking that government should at least be able to be at par, with even ECOWAS countries. And let me tell you that if you look at the ad valorem tax in a few West African countries, Benin is 50%, Cote d'Ivoire 44%, Burkina Faso 45%, Ghana 175%, Niger 50%, Liberia 80%. Guess what? Nigeria is how much? 20%. So we are even way below the current, tax regime in West African countries. We think the government needs to act, seriously on that. There was an increase that took effect last year, and the specific tax of we expect by July should move to 2 naira per stick and 40 naira per pack. That's not significant enough. The WHO recommended that 70% of the retail price of cigarettes should be taxes, and the reason being that it is one of the most effective ways of reducing consumption. It reduces initiation. It reduces access to cigarettes by children and youths, and it's a win-win situation. While we are also using tax to promote public health, you are also, increasing your revenue as a government. So today we want to call on government to begin that process of creating the administrative infrastructure that will ensure that a fraction of taxes from tobacco can be used for public health by first, setting up the Tobacco Control Fund as stipulated in the National Tobacco Control Act 2015, and then that all the relevant agencies should begin to communicate about how, a percentage can be dedicated for tobacco control and public health. and not necessarily to mean, replacing a source of funding. I mean, we want this to be an additional to whatever is existing to the ministry and agencies involved in tobacco control. Thank you, and thank you very much.